Cultural Safety in Practice: How to be an Ally. This video was developed by Interior Health's Journey to Aboriginal Cultural Safety program. The interior region of BC is home to a diverse and vibrant Aboriginal population. Interior Health provides a variety of health services to First Nations, Métis, and Inuit people living in urban, rural, and remote areas. A key strategy for IH is working with First Nations and Aboriginal partners to plan and deliver culturally safe health services. The 2015 to 2019 Aboriginal Health and Wellness Strategy provides us with a framework for becoming a more culturally safe organization. One of its 4 key priorities is advancing Aboriginal cultural safety to ensure welcoming, inclusive, and respectful environments for Aboriginal clients and families. But what is cultural safety, and why is it important to your practice? Aboriginal cultural safety consists of examining the historical and political factors which create health inequities and power imbalances between Aboriginal peoples and health providers. This is what we term the colonial narrative. Cultural safety is defined by the Aboriginal recipient of care. Many health providers are at different stages in their journey toward cultural safety. However, we have all inherited this colonial narrative, and therefore all have a shared responsibility to address the current health disparities that exist among Aboriginal peoples in Canada.
As an Aboriginal person receiving health services, I expect to feel safe in the healthcare system. This means that I am the one who defines the extent to which my culture is a part of my care and healing journey.
Now, what does Aboriginal cultural safety in healthcare actually look like? And as a health professional, how can I be an ally?
As a clinician, I promote cultural safety by being self-reflexive. I humbly recognize the implicit biases I may have towards Aboriginal clients and how these may affect the quality of the health encounter. I also make it a point to acknowledge the health beliefs of my Aboriginal clients and incorporate their cultural perspectives into their care.
As a physician, delivering culturally safe care involves adopting a relational approach. This means working collaboratively with my patients and their families. The underpinning here is compassion.
As a patient registration clerk, I respectfully ask clients about their Aboriginal self-identification. This allows the health team to develop care plans which meaningfully integrate Aboriginal clients' cultural and wellness preferences.
As an Aboriginal patient navigator, it's my job to ensure that all Aboriginal patients and their families feel welcomed, supported, and validated during their care journey, in the hospital and back into the community. I also ensure that patients have access to spiritual care, ceremony, and cultural support.
As a cultural safety educator, it's my job to advance Aboriginal cultural safety through conducting in-person education sessions. My role is to be a resource and provide IH staff with cultural safety knowledge and skills.
Now, as a healthcare professional, what can I do if I experience a situation that is culturally unsafe? For example, witnessing racism or stereotyping directed at an Aboriginal client. How can I stand up? The following are actions you can take. First, understand and recognize that people may be acting on implicit biases and are often unaware of the harms which result from their actions or comments. Next, if you feel comfortable, stand up and intervene. Choose an appropriate setting to have an assertive yet respectful talk with the person. Find a safe environment which promotes discussion. Be gentle and welcome dialogue. During the conversation, try to challenge and deconstruct negative stereotypes to unpack what transpired. Finally, always report any culturally unsafe health encounters to your manager. Debriefing with your supervisor or colleagues is also important.
As a senior leader, I acknowledge the colonial narrative and its effects on the health and wellness of Aboriginal peoples. I promote cultural safety by ensuring that all staff, policies, and programs at IH incorporate a cultural safety lens.
In summary, the key components of Aboriginal cultural safety are educating yourself on the colonial narrative, self-reflecting, shifting power imbalances in the healthcare interaction, acknowledging that cultural safety is defined by the Aboriginal recipient of care, a commitment to lifelong learning.
I am an employee with Interior Health, and this is my cultural safety pledge. I pledge to stand up against racism and stereotyping against Aboriginal peoples in the health system. I am committed to doing my own learning and putting that learning into action to make all health services safe and welcoming for Aboriginal clients and their families. Aboriginal cultural safety starts with me. It starts with you. I pledge to be an ally.